Chapter 1, Lecture 2, the 4 basic questions. In the previous section, we mentioned that economics is about making choices to allocate limited resources. And the trade-offs are unavoidable because resources are limited and scarce, basically, in a given period of time. So therefore, society must make fundamental choices. Now, since we have limited resources and unlimited ones, we have to make smart choices. Now, but making a choice for a society is much more difficult than making a personal choices, right? So in a society, how do we have to allocate resources to make population health better? Each society must make important choices regarding the production, distribution, and consumption of the goods and services. Let's see what are those 4 questions, fundamental questions that society have to make, basically, have to answer. So there are 4 basic questions that we have to answer. So the first question is, what mix of non-medical and medical goods and services should be produced in the macroeconomy? Now, just pay attention. In this case, there is a trade-offs between using the resources in medical versus non-medical goods and services. So basically, we have to use our resources for training teachers in education department, or we have to basically train the students for basically for having a more number of doctors and nurses in 10 years. So these are the mix of non-medical and medical goods and services should be produced in macroeconomy, and usually we have to make the plan like 10 years, 20 years in advance. Then the second question is, what mix of medical goods and services should be produced in the health economy? Now, when as a society, basically we decided how much of resources to be spent in the healthcare. Then, even in the healthcare, there is a basically, a big decision. Where do we have to use the resources? Do we have to spend the resources on more basically in prevention or treatment? Even in treatment, do we have to spend more in the ED hospital or inpatient, outpatient, on maternity or nursing home? So there are so many choices. Basically, we have to make a decision, and any mistake in distribution of this allocation of the resources may actually basically end up to the disaster if you cannot think about in advance, for example, how to allocate enough resources for each of these necessary services that we need, and goods and services that we need in the next 10, 20, and even longer period of time. Now, the third question we have to basically answer is, what specific healthcare resources should be used to produce the chosen medical goods and services? Now, here we are talking again within the healthcare services. What is the best mix of inputs should be produced within health services? Do we have to use more personnel, or do we have to use more basically material or machine to produce the chosen services, right? There is in economics, we have substitution and complement effect between these resources, and we have to basically decide from the beginning, basically what combination of resources can actually reach to the best actually final product or services. So now we know how much money, for example, we have the allocation of the money we have to spend in the healthcare services. So then we decide. So we know that how much resources we have for prevention, how much do we have for treatment. Then so what is the best combination of these basically different resources that we have? Those three resources that we already talked about, the input capital and personnel and basically medical goods and services. So we are trying to have a production efficiency by choosing the best mix of input to maximize the chosen output, right? So we already decided about what are the chosen selective output we need. So we wanted to have a production efficiency by best selection of the mix of inputs to maximize the chosen output. The fourth question that we have to answer is who should receive the medical goods and services that are produced. Now, this is basically that very hot topic these days, that who should receive the medical goods and services that are produced. So is that like, do we have to have a universal healthcare plan? Everybody use it for free, everybody should be included, or you have to have some selection and some criteria for using the resources. So basically, the society should answer these four basic questions in health economics. So allocative efficiency answers the first two questions because we have to choose the best way to allocate resources to different consumption uses. The consumption uses are healthcare versus non-healthcare uses, such as, Department of Defense, education, etc. And also, what combination of goods basically and combination of the resources we need to actually produce what combination of the healthcare resources. Those are the first two questions. The last two questions, the production efficiency answer the third. Basically, so we're deciding about choosing the best mix of input to produce the maximum output. We talk about the fourth question later. So what is the production and allocative resources? So economists usually use production possibility curve. It's an economic model that is called basically PPC. Sometimes some book they say that PPF stands for production possibility frontier. This model gives us all combination of products could be produced efficiently given the combination of the resources and technology we use. Now, so production possibility curve illustrates production and allocative efficiency, and it's an economic model that depicts graphically basically the various combination of any two goods or services that can be produced efficiently given the stock of resources, technology, and various in the institutional arrangement. So basically, this includes also policy in any and policy and any production constraint in any country, a specific country. So this is the production possibility curve. So in the vertical axis, we have quantity of maternity services, we call M, and then in the horizontal axis, we have quantity of nursing home services, we call N. Now, so these are the quantity. Now, the combination of these are in this curve. So what does it mean? It means that if you use the resources, we can actually, our resources that can be used basically for both of these services, goods and services for maternity and nursing home. Now we have make a choice. We have to make a choice here. If our society prefers, maybe our society are a young, actually, mostly young. Therefore, our society prefer to spend more resources on the maternity services. In that case, we pick point A. But when we pick point A, which is the maximum amount of resources basically used on just one services on maternity, and in this case we have 0 nursing home services. So point A is basically 0 nursing home, but maximum quantity of maternity services. Now, in the extreme other choices is that alternatively, in other extreme way, we can choose if we are, we have a very aging population. So we prefer to spend all our resources, hypothetically, of course, on nursing home. Then we choose point E and we allocate all our resources. And remember that this is any point of time. So suppose that this is in 1 year, but you have to specifically mention that. So you spend all the resources on point E. In that case, there is 0 resources allocated for maternity services. Now, between these two extreme points, you can actually choose. Most of the society, they choose the combination of these two services because most of the society, they need both services. So therefore, if you choose B, point B means that you have this amount of maternity services and this amount of home services. If you choose point C, means that you have basically MC amount of maternity services and NC amount of nursing home services. And if you choose point D, it means that you have MD amount of maternity services and ND amount of nursing home services. Now, what about point EF here? Point F is an efficient, means that you could actually choose point B, but some of your resources are basically unemployed. Either you have some machine in or hospital bed that you're not using efficiently, or you have some personnel that you can use them, but you're not using. In society, this happens when there is a lack of information, or there are some constraint, policy constraint, or any constraint basically that makes these resources to be idle. So this is inefficient. So you have to basically try to remove those problems. Either there are lack of information, then or policy constraint. You have to remove those and to use those idle resources to get to the point B. What about point G? Point G is unattainable at this time. So we can't actually reach to that point at this time with the current level of the resources we have and with the current technology. But by any change in the technology, or say that current level of labor resources, we can actually reach to increase. For example, if we have an immigration, number of the physicians, nurses, healthcare basically personnel move to the country. So this actually shift this curve up. And as you can see, this is actually outward curve, and we talk about that later. So then with any, suppose that there was a new technology that increased actually the production level with the same amount of resources we have. So therefore, we can reach to the point G. So that's actually the case for production possibility curve, PPC, or sometimes they call PPF. So again, any point on the curve is efficient. Any point. So all the point A, B, C, D, E are efficient. What means that you are using your resources fully using your resources. There is no idle resources, but actually it's here. So basically, remember that by making any choices here, choosing A, there is a trade-off. You're giving up the resources that you can actually make more nursing home. And by choosing this point, you're giving up. There is a trade-off of using the resources by producing more maternity services. So any choice here, it's basically usually these choices are based on society's preferences. So most of the societies produce B, C, D. Again, usually we don't have these extreme choices. So just pay attention that when we are making a decision, there is a trade-off, and then there is an opportunity cost of making decision. What does it mean? Means that opportunity cost is what you give up to get another thing. So usually the second best choice is opportunity cost. So if your society decide to produce at point D, then means that you're giving up actually the resources to spend to use for maternity services. Now, when we move from D to C, we have to give up the quantity of nursing home services to produce more maternity services. So you're moving basically. You have to give up this amount of services from when you're moving from D to C, you're giving up the amount of ND to NC to move to this to get actually the amount of MD to MC. Now, so this is called allocative efficiency. This is actually even in personal life. When you make a decision, for example, you have $10 and you wanted to make a decision what to buy with that $10. Then buying a pizza versus buying clothes, or so basically means that if you are hungry, probably you're going to buy pizza, and if you're not hungry, you're going to buy clothes. But buying the clothes has the opportunity cost of basically giving up pizza. Then you have to actually maybe you need your clothes, and then you can actually buy something very cheap to actually make yourself full. So what you give up here, it's actually called opportunity cost. Usually accountant, they don't include the opportunity cost. Economists only they think about the opportunity cost. So it is not basically a kind of real cost, but you have to consider that in making any decision. Okay, so production possibility frontier, point C is basically at point C and D, medical resources are fully utilized, and so the amount of the unit of maternity care services is MC, unit of nursing home services in C, and for point D, then you have this medical resources are fully utilized, in basically the amount on maternity uh, care and nursing home RMD and um, ND. So we talked about the movement from point C to point D. And we talked about opportunity cost of production, which is an additional unit when we are basically moving from one point to another point. So an additional unit of nursing home services, if you wanted to get, then you have to give up the additional maternity services. That's the foregone. So we have the definition of the opportunity cost, value of the next best alternative that is given up. The law of increasing opportunity cost is basically showing our curve, bowed out shape of the production possibility curve. So what does it mean? Means that opportunity cost increases with the movement along the curve because of the imperfect substitutability of the resources. What does it mean? Means that if you're moving from, for example, B to A, you have to put all the resources on production of maternity services. Some of the resources may not be completely fully specialized for maternity services in a society. So therefore, as you're moving toward the extreme side, so you're giving up more. So that's why it's bowed out, giving up more than you're getting. So that's the explanation of the, bowing outward. And we talked about point G. And the fourth question, it deals with the distributive justice or equity. So we talked about basically who should get the basically the production. So this deals with distributive justice or equity. Is the distribution of services equitable or fair to everyone involved? So we can say that yes. For example, especially in the healthcare, we say that health care is a basic human right. Everybody has to have that free. But if we make that free, do you think that would be fair for some people? They work hard, and some people they don't feel that they need to work hard because that healthcare is freely available anyway, and they can even abuse the healthcare services in some cases that we talk about. So let's see what is. So we are basically dealing with efficiency and equity. So in economics, we are dealing with these two trade-offs between efficiency and equity. If we allow the people basically or society allocate the resources based on who works harder basically, then with the free distribution of the resources basically we can reach to the efficiency, full efficiency, assuming there is no basically constraint, especially the policy constraint we are talking about. In the other extreme sides, there is equity. What if some people they cannot really work, so that's not fair. So then we are dealing with equity. So two ways of distributing the output. Two extreme sides are pure market system, and in the other extreme side we have perfect egalitarian system. Now there is a basically we don't have any country following in these two extreme sides. Usually we have most of the countries somewhere between these two. But let's talk about these two extreme sides. Pure market system and perfect egalitarian system. In a pure market system, goods and services distributed based on each person's willingness and ability to pay. So whoever has the money has the goods and services, basically. Simple. Because people face an incentive to earn income. So this actually makes you to work hard because when you're working harder, you have the incentive that you are going to earn more, and therefore you have more money to spend and can enjoy more. So that is actually, economists they believe that that is the most helpful incentive. For example, in education, if we don't have a final grade, nobody's going to work hard most of the time. So that's one incentive, to give you at least motivation to work harder. Now, efficient allocation of resources, we believe that, by kind of giving this incentive of working harder, then one of the resources, as you know, are the personnel. So you're not going to actually spend your time without, if you don't have a job, not looking for a job because, in some of the countries, they have a social welfare, and the people, they don't have to look for a job hard enough because in any way they have the basic human rights available, the healthcare system, and they have some social welfare. So there are some idle, basically unemployed people. Those people, they can work, but they are not working. And even like when we are talking about the resources, always think about those three resources we already talked about. So keeping the economy, when we are working in a pure market system, means that whoever works get the product, the outcomes. Basically, we believe that that is the efficient allocation of resources, and the economy operates on the PPC, production possibility curve, on the curve. So no resources will be idle. Now, so how the price mechanism works in pure market system, basically that price determine who can basically have the product and services. So in economics, basically we say that needs and wants are different. So everybody wants, but basically willingness to pay and basically can afford. Price determines rations the mechanism. So who can basically afford to have the final product. So the differences in ability to pay, again, that actually price determines who can pay and have the final product. Some have consciously actually chosen to work harder and save more than others, and some people have less income because of they have unfortunate life circumstances. For those cases, of course, we have to have social welfare, but basically people without sufficient income face a financial barrier to obtaining basic goods and services. We are talking about like a basic human rights. So how we can actually balance these efficiency and equity to be fair, but at the same time we wanted to keep our production possibility frontier on the curve, to basically guide the people to work hard and not to leave any resources idle. In a pure market system, so there is a income disparity, of course. Some people may be denied access to the very basic human right, especially in healthcare. In a pure market system, so therefore, some people they view as inherently unfair, and in terms of distribution of important goods and services, such as healthcare, that is unfair, of course. In the other extreme side, we have perfect egalitarian system. It's basically it's a central committee decides what to produce, how much to produce, for whom to produce, for whom to produce, basically. This ensures basically a central committee. Everyone receives an equal share of goods and services. So equal shares of goods and services, in spite of basically how much you put effort. So doesn't matter if you work hard or not, you get the same amount of goods and services. So why do we have to work hard? So there is no incentive. An incentive may exist for people to choose to work and save less, but that's inefficient allocation of resources, and most of the time economy may operate inside the PPC. So I have worked in Canadian government, basically for Canadian government for 8 years. There are some people, they never actually think about looking for a job because their healthcare system is always there, and they have some, welfare, basically social welfare that can cover their basic needs. So there is no point of looking for a job, although they can really work. I know some of them. So it's very difficult to decide. Sometimes on the other hand, you see some homeless people, they need some basic human rights, but they don't have that access to the human rights. So it's very difficult to balance the basically efficiency and equity. Now, most of the countries around the world, they have mixed system. Some close to the one extreme side, of course. United States is more market system, and European countries are more basically central. They have central system. So most countries rely on central versus market distribution, varying by degree across countries. In the United States, many goods and services are distributed by market, government. What does it mean? Means that definitely we have government to provide Medicare for people over the age of 65, and Medicaid for people with low income. And we have supplemental nutrition assistance program, and temporary assistance for needy families, and the Medicaid programs, but in some states are basically higher than in other states, of course. Definitely we have some private insurance, health insurance, and then also some insurance through our work. So it's definitely a good example, United States, about the mixed system, so we talk about that. What percentage of the total populations are under the market, and what percentage are under government later. Now, what are the implications of the 4 questions? So we know that we are dealing with a scarcity of economic resources, and it results in each societies making hard choices concerning consumption and production activities. So we wanted to know how we can actually allocate the resources in the most efficient way. So each society have basically different preferences to produce the combination of these goods and services. Um, so then in economics, in health economics, we wanted to learn how we can actually employ these resources, um, so basically most cost effectively. You have when you are making the best choice, then you wanted to know what is basically giving up, what are the trade-offs here. So that's the first thing you have to determine. When you are making your best, the first choice, then if the trade-offs are between young and old, between prevention versus trade-off, and between, say, that men's and women, for example, basically we have limited resources. So when you're spending more money, when we say again resources here, when you're converting to money, we talk about money, but basically when you're spending the resources on one choice, means that giving up the second best choice and how much you're giving up. So you have to basically, in economic, we have to estimate that amount, and what is the opportunity cost that you're giving up. So you have to estimate all of those basically. In the implication of the 4 questions, we are achieving equity. We have to basically consider that we are dealing with the trade-off between equity and efficiency. Okay, if you wanted to provide healthcare for everybody freely, easily, like Medicaid, say that we make it universal basically, then in that case, so you are actually definitely you're dealing with, you're going to face with more inefficiency of using the resources, keeping the resources idle. So we are not moving on the production possibility curve. We are inside. So in this class, in health economics, we are trying to see how we can use these resources more efficiently, even take some of those policy constraints to move even above the curve, because basically sometimes coming up with the good policy is like or a new technology can actually give us more output with the same amount of resources, but just so that's what you're doing in this class in health economics. You're trying to figure out the problems in our healthcare system and come up with an intervention. That intervention could be a policy, a new policy to make our healthcare system more efficient.